Hi, I'm Joe Roth. At New Jersey Sharing Network, we're committed to saving and enhancing people's lives through organ and tissue donation and informing people about our life-saving mission. That's why we're proud to support programming produced by the CAUCUS Educational Corporation and their partners in public television.
State of Affairs with Steve Adubato is brought to you from the Agnes Veris NJTV studio at 2 Gateway. Funding has been provided by ShopRite Supermarkets, Seton Hall University, where leaders learn, the New Jersey Association of Health Underwriters, New Jersey's benefits specialist, Johnson & Johnson, New Jersey Sharing Network, dedicated to saving lives through organ and tissue donation, the Northward Center, and by Verizon. Promotional support provided by Commerce Magazine and by New Jersey Family Magazine and njfamily.com.
Welcome to State of Affairs. I'm Steve Adubato. We are coming to you from the Agnes Veris studio here at NJTV. We're welcoming Robert Garrett, Co-Chief Executive Officer, Hackensack Meridian Health. Good to see you, Bob.
Good to see you, Steve.
Not much happening in the healthcare world, huh?
No, nothing at all. Nothing in the news, nothing going on.
By the way, talk about this, the partnership, the merger happened when exactly?
Well, our merger, Hackensack University Health Network and Meridian Health merged July 1st. So we're 9 months old as a new organization, and lots happened in those 9 months. We've made great progress on a lot of fronts. So we're excited about the future of our organization. And in spite of what you hear about healthcare, we're excited about the future of healthcare.
New brand just came out?
It did. We launched it last week with a reception for all of our leaders at the NJPAC in Newark. And our brand can be best described as well orchestrated. We're a well orchestrated organization, an organization that plans and executes really well. So we thought a great place for the launch would be an orchestra, site for famous orchestras, which was the NJPAC. And if you look at our new logo here, there's a center to it with a hole that looks like kind of an orchestra pit with the orchestra surrounding it. So a lot of symbolism around it, but we're excited about what the brand really represents, which is really bringing health and care together. Because as a healthcare organization today, it's not just about delivering care; it's also about keeping the population healthy.
To disclose, I've worked with a fair number of physician leaders and others within the Hackensack Meridian system doing communication, coaching, and seminars over the years. I know the system quite well. And Bob, I want to ask you this. One of the things that has made the news is, it's not really a merger, but it's a collaboration, a partnership with Memorial Sloan Kettering. It is obviously, talk about brands, a cancer institution that's got incredible reputation. What is the partnership and why does it matter?
We are incredibly excited about the partnership with Memorial Sloan Kettering Cancer Center. So it is taking two great brands, putting them together, but most importantly, we think it's going to transform how cancer care is delivered in our state.
How? Give us an example.
So how it's going to work is there's really two parts the way I look at it. There's 11 existing cancer centers, ambulatory cancer centers in the Hackensack Meridian Network, all through New Jersey. There's soon to be 3 Memorial Sloan Kettering sites. So for those 14 sites, we will co-brand those organizations with Memorial Sloan Kettering and Hackensack Meridian Health. But more importantly, we're going to develop one set of clinical protocols that will guide how cancer patients are treated. So if you're treated at Ocean Medical Center or at Hackensack University Medical Center or at Memorial Sloan Kettering, you will get the same treatment, the same set of clinical protocols. That's one part of the partnership. The second part is together we will own and operate cancer centers, new cancer centers in the state of New Jersey. So we're looking for the appropriate sites. We're looking for the right location and the right mix of demographics to locate new cancer centers where Sloan Kettering, Memorial Sloan Kettering, and Hackensack Meridian will actually own them together.
Cancer rates in New Jersey, are they higher than we think they are, or is it that our reputation?
No, they're significantly higher. There's been studies by the American Cancer Society and other organizations that indicate that they are, 1.5 times, 2 times higher, depending on the part of New Jersey that we're at. So unfortunately, it's a disease that's going to be with us for a while. And what people really want is they want quality cancer care delivered in convenient locations. So they don't necessarily want to have to go to New York or to Philadelphia if you're in New Jersey. So by putting Memorial Sloan Kettering and Hackensack Meridian together, we think we can deliver the best quality care in a very accessible location. We'll have over 1,000 clinical trials, which is unprecedented, 1,000 clinical trials available to cancer patients. And between the two organizations, Steve, one other stat I like to talk about because it's staggering. Between the two organizations, we will do over 900 bone marrow transplants this year, which means not only are we #1 in the nation, but we'll be the 2nd largest in the entire world.
The other thing you mentioned is, which is important because medical education is a piece that we've talked about a lot, the physician shortage. New Jersey losing a lot of physicians, people who may be trained here and go someplace else. The new medical education facility, the new medical school, it's a partnership with, talk about so many partnerships here.
Right.
The Seton Hall partnerships. Talk about it and why it matters in terms of caring for patients in this state. What is it? Is it 2018?
Yeah, 2018. So we formed a partnership with Seton Hall to establish what will be New Jersey's only private medical school. There is a physician shortage in New Jersey that is more significant than the
national. Is it
national.
Primary care physicians more than anything else?
Mostly primary care, but also obstetrics and gynecology. It's even general surgery, Steve. So it's widespread. And in just a couple years, by 2020, New Jersey will be short about 3,000 physicians. Nationally, it's about 125,000 physicians. So by having a private medical school, we hope to retain New Jersey residents who want to study medicine right here in New Jersey, and also be able to attract some real talent from out of state. And the statistics show where students go to medical school, they are more likely to practice medicine. So we think this will be a great tool to provide a supply of physicians for generations to come.
Give me 1 minute on the national healthcare landscape changing every minute as we speak.
I think there's a couple trends that are going to happen, and I think as healthcare leaders, we need to step up no matter what happens in Washington. So whatever bill ultimately comes out of the Congress, I think there's going to be certain characteristics, like there's going to be more decision-making put into consumers' hands, less government, less employers, more in consumers' hands. So what does that mean? That means we have to provide accessible care to consumers. We have to make sure care is as affordable as possible because they're going to have choices. We also need to be more transparent as an industry, meaning our quality results, our patient safety, even our pricing. We have to be very, very transparent to the consumer because they're going to be shopping around. More decisions are going to be made by the individual consumer. So I believe no matter what the final bill looks like, it will have those characteristics.
Before I let you out, Garden of Dreams, real quick, what is it?
So the Garden of Dreams, it's part of a partnership called Tackle Kids Cancer, which is a great program which we're spreading awareness and raising money for pediatric cancer research. We've already raised $4.5 million, thanks a lot to the help of Eli Manning and the New York Giants. Who
the NFL has recognized Eli Manning for that.
As the co-man of the year, absolutely. And recently we announced a partnership with Madison Square Garden and the Garden of Dreams. So we're happy to have them on board. They're going to help promote awareness and to raise money for Tackle Kids Cancer. We're really excited about the partnership. Great, iconic organization. Some of the sports history is made there almost every night. So we're really thrilled to partner with those guys.
Thank you, Bob. Appreciate it.
Steve, thanks. Great
for the
to see
update.
you.
Not enough things going on, huh? Yeah. Stay with us. Be back on State of Affairs right after this.
To see more State of Affairs with Steve Adubato programs, visit us online at stateofaffairsnj.org. If you would like to express an opinion, email us at info@caucusnj.org. Find us on Facebook at facebook.com/Steve Adubato, PhD. And follow us on Twitter Steve Adubato.
Welcome back. One of our great friends is back after doing some important things. Evelyn Mejil is a global humanitarian. She was the CEO and executive director of the Senator Winona Lippman Child Advocacy Center. Welcome back, my friend.
Thank you. Thank you. It's good to be back. And it's good to be back here with you.
Well, Raph and I, my partner Raphael and I, missed you and your appearances with us, and now we have this new series. So I got to ask you, you went away for important business. You traveled where?
Well, I went to about 11 different countries in the past year, a little over a year now. And so all over Southeast Asia. Yeah. So
why did you go?
I think I got to a point, and I know we've talked about this a lot, where I felt that we needed to have a stronger voice in terms of the violence that was happening against children and women. We talk a lot about children, but we know that the majority of those children are girls, females, and so they go on to be victimized when they get older. And I just thought that we needed to create a stronger presence, a stronger voice, something that we can unite, behind and talk about what's really happening, because it is a global epidemic. I know we talk about what's happening in New Jersey, but yeah, absolutely.
What did you see? I mean, because all the times you were on with us, I mean, you remember, and the Winona Lippman Child Advocacy Center, you talked about this abuse of these children here.
Yes.
What abuse did you see around the world?
It's very different, Steve. It's you're talking about seeing the abuse right in your face. You're walking the streets and kids are lined up in the streets, and you have perpetrators coming by and picking up these children, abusing them. These kids are being sexually exploited, and then they come and return them.
How young?
As young as 3 years old, 4 years old. I remember in Thailand, we had this one incident where we had 2 males walking around with a 4-year-old girl that had been kidnapped while her parents were there on vacation from the UK. And it was 2 o'clock in the morning, and there was a team walking around, and we see this little girl with these 2 men, and they are just dangling her around like she's a rag doll, and they're doing whatever they want, and it's just out there for everybody to see.
Who cares?
It's hard to answer that.
You're there, you see it happening.
It's really hard to answer that.
Who else cares? What can be done? What are the authorities doing?
What we're seeing, and I guess what I saw in this trip, Steve, and I think is the most disturbing, is that we don't have a united front in terms of like our global legal system. I'm talking about the UN, UNICEF. I mean, we are really neglecting these issues. A lot of these issues and a lot of the organizations that I work with, you're talking about individuals that decided to take it upon themselves to do something about this issue. They take it upon themselves to create nonprofit organizations, to be able to create a response system for children that are being abducted, children that are being sexually exploited. You're talking about just a regular person going into some of the most dangerous parts to try to rescue children, and they do, and they do. And I mean, I just visited, an orphanage in both Bali, Indonesia, and in India, and both of them had more than almost 100 kids. And most of the kids that were there in this orphanage were rescued because they had been trafficked, because they were being sexually exploited. And so you have, regular individuals with kind hearts, with good hearts, that are going out there, putting their lives at risk, doing what we're supposed to do as leaders of the world, together.
But there is no coordinated, systematic effort to do that.
There is and there isn't, right?
There is, but it's not strong enough.
It's not strong enough. I mean, we're not doing enough. And that was the problem that, obviously, one of the things that we were talking about here, what are we doing about the kids that are being abused, right? We talked about the statistics. Over 6 million children are being abused in the United States. Over 40 million children around the world are being abused. And so when I was having conversations with representatives of UNICEF in different countries, one of the things that's like, we don't want to intervene with, the local government. We don't want to intervene with the local state of affairs.
What about if those local folks aren't doing anything?
Exactly. If they weren't doing anything, a lot of these children would be dead. They would be.
How did this trip change you?
Oh, it changed me in terms of, I think for me, and when I was here last with you, you asked me a very important question, and it was the first time that I really came out with this, and you asked me why I was so passionate about this work. And it was the first time that I was able to publicly say, you know, well, I'm also a survivor. And so for me, I realized just how important it is to give a voice to the voiceless. I really did. When you asked me that question the last time, I remember thinking I just wanted to crumble. You know, I answered it, but inside of me, I was like, oh my God, how do I speak about this in public? You know, what would people say once I say that? No.
But even though you're an advocate and even though you're a professional in the field?
It was always, you know, I care about this issue, I love this issue, and people can see that I was very passionate about it, but I would never get to a point where I can say, you know, I was a victim as well. You know, this happened to me. And so for me, it was important to give a voice to those that shared my same shame and the same, you know, pain of being victimized in that way. And so when I was out there, one of the things that I felt that was very empowering for victims was to be able to say, you know, I'm a survivor too. You know, we're in this together, but we don't have to be our story. This doesn't have to be our destiny. We don't have to continue to be a victim for the rest of our lives. And so I thought that that was really important. So it changed me in the sense that I realized, you know, these kids, they're not at fault for what people are doing to them.
They're
and neither
victims.
was I.
They're just victims.
Yes.
You were a victim.
Exactly.
What do we do now?
I think that people really need to stop being scared about this issue. It's one of those things that everybody says, oh, you know, I mean, I was at a dinner the other day, you know, I just came back from India. My friends are, you know, we're together, and they're just really happy to see me. And 2 minutes into the conversation, then, you know, they're asking me about the trip, and they say, oh, God, this is such a downer. Can we change the conversation? Is that right? But it's like this for a lot of people.
Let's not talk about this.
Let's not talk about this. It's too hard to talk about. So
right now on public television, FiOS, everyone watching right now, is it a downer or it should be what? Instead of a downer, what should it be?
Talk about it. Don't allow it to be a taboo issue, because the more we do that, the more we silence our victims. Because our victims are thinking, oh God, you know, I can't put this burden on society. Right. I can't put this burden on somebody. So let me just be silent about what happened to me, because I don't want you to be uncomfortable with my pain.
You promise us you will come back and keep talking and not be silent.
Absolutely, yes.
Welcome home.
Thank you. Thank you so much.
Good to see you.
You're awesome.
Stay with us. We'll be right back right after this.
To see more State of Affairs with Steve Adubato programs, visit us online at stateofaffairsnj.org. If you would like to express an opinion, email us at info@caucusnj.org. Find us on Facebook at facebook.com/Steve Adubato, PhD. And follow us on Twitter at Steve Adubato.
State of Affairs welcomes Debra Vizzi, who is President and CEO of the Community Food Bank of New Jersey, an absolutely terrific organization that does what?
Yeah, the largest anti-hunger, anti-poverty organization in the state. Yeah. And we feed millions of people.
Yeah, we're actually going to put the website up if people want to find out more and a way to be helpful. How serious is the hunger problem in the state of New Jersey? Then we'll talk about the United States.
It's large. There is hunger in every county in the state of New Jersey. And it's something that we really work on communicating with New Jerseyans, because I think people really think it's in pockets, but it's in every single county. We have a pantry, a shelter, a soup kitchen in every county in the state.
Yeah, by the way, there's a PSA, public service awareness campaign that we have going on right now that tries to talk about what the issue is and what people can do. But I'm curious about this, the after-school cuts that are being proposed. Who's proposing the cuts? What impact would those cuts have on whom, and why does it matter?
It matters greatly. I mean, you know, for many of the food banks throughout the country.
These are federal cuts?
Yeah, federal cuts. You know, the after-school programs are pivotal for children to get healthy meals and to have regular meals throughout the week. You know, for the food bank, we always talk about the summer being the most vulnerable time for us. Most of our donations—
There's no school.
Exactly, and most of our donations happen during the holiday season from September to December. But now, as we're approaching summertime, this is really crisis time for us, because now breakfast and lunch is no longer available and children go hungry. We know this to be a fact. And not having after-school programs supplement meals is a real issue, and it's going to affect outcomes.
So But Deborah, not that you know what the Trump administration would be thinking, but if they would argue, hey, listen, let the states take care of that. That's not a federal responsibility, you say?
I say it is a responsibility of the government because there are lots of things we can do without, but we cannot, as a country, go without eating. And children cannot go without eating. And so it's all of our responsibilities as good neighbors. I mean, most of our attention has been overseas on these issues. And we're having this problem in our country, in our state, in our communities. And we need to pay attention to that first.
Let's talk about some issues or some efforts going on in New Jersey. Assemblyman Holly is engaged in a piece of legislation. Sometimes we put up on State of Affairs the number of the bill. Check it out. It's A4499. Check it out. But what does it do and why does it matter? Because there's a population that's really being hurt right here.
Right. I mean, you know, Assemblyman Holly and I discussed the fact that students right now are growing hungry in colleges throughout the country, and particularly in New Jersey, at record numbers. And I was a hungry child and a hungry college student as well. And so we introduced legislation. If there are leftover dollars on a meal plan, students can help other students by using either leftover dollars or dollars that they're purchasing initially to feed a hungry child.
Can't do it right now?
Cannot do it right now.
Hold on one second. I've got $40 left on my meal plan. I'm at Rutgers or wherever I am, right? Right now, by law, I can't take it and say, Deborah, here.
Correct.
Legislation has to be passed, both houses of the legislature, signed by the governor into law to change that?
That's right. And it seems like it would just be such a wonderful thing for us to do. It just makes common sense. It's logical.
It's also charitable.
It is charitable. And if we could get one student to just give one meal, we could, you know, expand our presence in pantries in colleges. We could expand our network around certain counties that help students, et cetera. So it's just a win-win.
Talk to us about this. There are some different initiatives at the Community Food Bank of New Jersey. By the way, check out the site. Some terrific things going on there. Kids Cafe. What is it?
What we do is we feed dinner to children every single night. Thousands of children throughout the state get a meal from us that is provided by the Community Food Bank of New Jersey, which is a wonderful thing. Kids go to after-school programs and don't have dinner or are waiting for their parents to pick them up at 6 o'clock. We feed them while they're waiting. For
those of us who have been to the Community Food Bank of New Jersey, it's an extraordinary facility, and there's so many volunteers that help out year-round.
Yeah.
If it were not in place, it's hard to imagine what would happen to all these people who need food, who are food insecure, if you will. But also there are mobile pantries. What are they? They're
literally exactly what they are. They're mobile. They're, you know, vans, and they go to different communities all over the state. We have a mobile pantry down in the southern part of the state that literally hundreds of people line up for. Seniors, you know, families.
What do you mean line up for, Deborah?
They basically line up to a mobile unit, you know, sort of like a camper, and they line up and they get food. And they do this on a regular basis. And we do that all over the state. It's an important piece for folks, particularly seniors, that can't necessarily get very far. Right. They may not necessarily be able to get to a soup kitchen or to a pantry.
Yeah. The other thing that we did a feature on our other sister series, One-on-One, on the Food Service Training Academy, this culinary initiative, which is fabulous. Real quick on that.
It's wonderful. It's a way of doing job training. We provide a 16-week curriculum to help people learn a culinary skill and then get a job. It's just a wonderful program. And the 360 of it is while the students are preparing, they're preparing meals for the Kids Cafe.
A couple questions before I let you out of here. I've asked you this before with my colleague Rafael Piramano. I'm going to ask you again. If people truly cared, if people wanted to make a difference, and I believe we do in our hearts, we don't sometimes know how, what could they do right now?
I think 3 things. Volunteer at the food bank, certainly. Start a food donation drive in your community, or if it's your child's birthday, ask people to bring meals or give a donation to the food bank. And then lastly, and more importantly, give money to the food bank. For every $1 that you give us, we can get $3 worth of food, something that a normal consumer could not do.
How does that work?
Our leveraging power, our purchasing power, and our ability to get more is just very different. We can buy things in bulk, sort them out, and get them out differently than a regular consumer can, because as you know, we're the size of 5 football fields.
Yeah, finally, it's hard to imagine what families are dealing with, and you know this personally.
Yes, I do.
I'm not going to ask you to go into it right now, but I remember you talked to us about
Right.
that. People cannot imagine what it's like to not have the food they need to live every day and to exist.
It's absolutely true. We do take it for granted. And, you know, if you're just hungry for breakfast, you know what it feels like in a short period of time. Imagine that on a daily basis, day in and day out. And that's what's happening for the world.
Debra Vizzi is the president and chief executive officer of a terrific organization called the Community Food Bank of New Jersey, doing important work every day.
Thank you. It's my
very
pleasure.
much.
Thank you
Appreciate it.
so much.
State of Affairs with Steve Adubato is a production of the CAUCUS Educational Corporation, celebrating over 25 years of broadcast excellence. State of Affairs with Steve Adubato is brought to you from the Agnes Veris NJTV studio at 2 Gateway. Funding has been provided by ShopRite Supermarkets, Seton Hall University, the New Jersey Association of Health Underwriters, Johnson & Johnson, New Jersey Sharing Network, the North Ward Center, and by Verizon.
As one of America's premier Catholic universities, Seton Hall is a place where leaders learn to excel, both in and out of the classroom, to explore new frontiers, to serve those in need, to succeed as champions, to achieve their dreams. Seton Hall University, where leaders learn.